feedlot dairy producers to this rural lands and protection board's meeting. Today's focus is the condemnation of carcasses due to liver-related disease. Abattoir guidelines state that any abscessation found in the liver will lead to liver condemnation and potential complete carcass condemnation, which, as we can all appreciate here, is not the outcome we want after the labour and financial commitment of raising an animal to slaughter. While there are several disease processes that can lead to liver damage and abscessation, today we're going to be focusing on Caudal Vena Cava Syndrome and its involvement in carcass condemnation. Caudal Vena Cava Syndrome is certainly not the most common cause of liver condemnation. In fact, it's actually only responsible for 1.3% of feedlot deaths. However, it is entirely preventable through nutritional management and therefore an important disease to be aware of. Prevention of this disease through nutritional management is particularly important, as by the time the clinical signs are visible, damage to the liver has surpassed abattoir standards and carcass condemnation is inevitable. In order to outline this disease, I'll be working through a case study, which I encountered last year in a dairy farm near Coffs Harbour. I was called out to the farm after being told one of their cows was experiencing severe nasal bleeding. Upon clinical examination, it was obvious that the cow had severe signs of acute respiratory distress. She was coughing, breathing very fast, had a very high fever with an increased heart rate. The nosebleed was severe and the farmer told me she had not been interested in eating. This bleeding resulted in anemia, which we can see from her pale mucous membranes, as well as digested blood in her feces. Caudal Vena Cava Syndrome has a complex etiology. It is most commonly seen in fattening steers and high-yielding dairy cows due to their greater intake of high-carbohydrate grain diets. Yearling feedlot cattle and adult dairy cattle are therefore more susceptible to the development of the syndrome. In order to understand this disease more accurately, let's have a quick look inside our cow here at the pathophysiology. This whole disease begins due to a decreased pH in the rumen. Let's take a closer look. High concentrate feeds leads to a decreased ruminal pH and therefore ruminal acidosis. Changes in pH cause a disruption to normal function, altered metabolism, and proliferation of certain bacteria. This can cause an inflammation of the rumen lining, known as rumenitis. Oh look, it's Fabio, the Fusoforum necroforum, in a pH environment. Rumenitis is an inflammation of the rumen characterized by erosion and ulceration of the ruminal lining. This loss of integrity to the normal lining of the rumen can allow bacteria like Fusoforum necroforum and Archaeobacterium pyogenes, which usually are confined to the gastrointestinal tract, to penetrate the rumen wall and leak into the portal system. As we can see, Fabio has used the portal vein to shimmy right through to the liver. And although Fabio is having a fabulously great time, he is causing tremendous damage to the liver, and abscesses are forming. Septic emboli are released from the liver abscesses and travel through the caudal vena cava to the heart and then lodge in the lungs. Once in the lungs, the septic emboli form thrombi, and a pulmonary pneumonia and multiple lung abscesses form. Hemorrhage can sometimes result from lung vessel rupture, which leads to the bleeding nose we saw earlier and the coughing up of blood. cow and can lead to sudden death. So what can your vet do to treat an animal that we have diagnosed with Caudal Vena Cava Syndrome? Unfortunately, nothing. There's no effective treatment for an animal with the acute form of disease. All we can do is try and make the animal feel a little bit better by treating the bleeding nose and bringing down the fever, by treating with antibiotics and supportive care. Although any affected animal has a very poor prognosis, this disease is entirely preventable. Let's cross over to my college, Dr. Cornelia Salage, a bovine nutrition specialist, to find out more.
Has your heifer been acting secretive lately? Sneaking out of the paddock at all hours? Loitering in the McDonald's car park? This is just normal heifer behaviour, right? Wrong. Your heifer could be the latest victim of an alarming trend that's sweeping the nation: secret cannibalism.
Psst, you know the video is meant to be about acidosis.
Prevention of Caudal Vena Cava Syndrome is definitely better than the cure, since there isn't one. Minimise the risk of ruminal acidosis to protect your cows from this disease. Here are some tips to help you achieve this. Firstly, provide a balanced diet. For dairy cattle, ensure that the total daily dry matter intake of your cows consists of more than 32% neutral detergent fibre. Of that 32%, more than 80% should be in the form of forage, between approximately 2 and 5 centimetres in length. This increases chewing time and stimulates the production of saliva. Additionally, feeding a transition diet to cows in the 3 weeks prior to calving assists the rumen to adapt from a high fibre to high concentrate diet. The fibre requirements of beef cattle are less well defined. At present, many Australian feedlots provide a ration which consists of only 13% neutral detergent fibre and supply rumen modifiers such as monensin to prevent acidosis. Secondly, it is important to manage the feeding process. This involves monitoring your cows to ensure that they are consuming the diet provided for them in its entirety. Factors such as selective eating, unpalatable low-quality roughage, and competition for feed can lead to inadequate fibre consumption. Finally, you can regulate rumen pH through the use of buffering agents. Sodium bicarbonate can be added to ruminant rations on a dry matter basis of 7 to 10 grams per kilogram. It acts as a buffer in the same manner as endogenous sodium bicarbonate found in saliva. It is most effective in a pH range of 6.2 to 6.5 and can help to increase rumen pH. So there you have it. By following these basic tips, you can prevent Caudal Vena Cava Syndrome from rearing its disgusting head amongst your cattle.
So there you have it. Those simple tips outlined by Cornelia will help you, as beef, dairy and feedlot producers, to prevent this disease. These tips will also be helpful in preventing other conditions, such as bloat. I hope you are all now more educated in the prevention of Caudal Vena Cava Syndrome and liver condemnations. Just remember, too much grain, beans or compound feed can lead to much more trouble than you may have thought. And in case you were wondering what happened to that sick cow I saw, thanks so much for your attendance and participation today. Are there any questions?